Dr. Edward Mills is the founder of the Atlanta Center for Restorative Dentistry, a graduate of Emory University in 1980. He has lectured extensively throughout the world on state-of-the-art restorative techniques. Dr. Mills is a fellow as well as the 2003 president of the American Academy of Implant Dentistry and a diplomat at the Board of Oral Implantology. Dr. Mills is the founder and current director of the Atlanta Institute for Advanced Education, a state-of-the-art educational facility utilized to train professionals through lectures, live demonstrations, and internet educational formats. Additionally, he is the current co-director of the Medical College of Georgia's 390-hour comprehensive dental implant training program, considered to be among the top continuing educational programs in dentistry. And he is the director of a 3-year hospital-based dental implant residency program at Emory Adventist Hospital. Dr. Mills has lectured extensively throughout the United States and abroad on both the surgical and the prosthetic aspects of dental implantology.
I'll tell you, from a digital perspective, sort of the aha experience that I ended up getting on why I should or why I'm glad I went digital is completely different than what everybody talks about. Actually, why people told me I should go digital. I got to be honest with you. I've been practicing, for 20-something years, and after a while, I was actually straining. I had more insight, I had more experience, I had more clinical, intuition. I had a much greater influence, on the educational process. But I just didn't have quite the ability to look at things probably the way I was when I was 23. Actually, I was having a discussion with my son. We were talking about how hard it was for Hank Aaron when he got to 700 home runs to hit those last 55. And he said, man, wouldn't it have been nice if he had a magic wand that he could have seen the ball like when he was 23? Like, how many more home runs would he have hit? And, how would he have impacted the field? What would he have done to the team? What would the Braves be like right now? And I thought, God, that would have been really interesting. And I said, actually, that's really what I've got access to right now. All of a sudden, what digital technology does is it lets me see the ball or patients or teeth and radiographs, not the way I was like when I was 23, but 100 times bigger. Instead of 40 shades of gray, I'm seeing 4,000 shades of gray. It gives me like a new excitement. It gives you sort of Superman senses. And so now, instead of trying to figure out how much I need to accumulate in my pension plan to get out of the game. I really want to play the game a lot longer. So I guess the candid truth of it is what digital technology has given me, besides this enhanced sensory acuity that I know is enhancing my ability to take care of patients. It just made me feel good about dentistry again. It's made me feel like I want to practice a lot longer. So that's probably the most important thing. In all candidness, when patients come to see us, they're pretty well expecting the state of the art. So I don't think that they're surprised or shocked or they don't make any comments, that we're pretty much all digital. But once they get here, even though they're expecting things to be sort of, state of the art, when they actually see their condition, they own it in a completely different way. When they see digital photograph, of a tooth or an area, and it's blown up on a screen. It's not a description that I'm sharing with them. They actually see it. All of a sudden, it's not I'm telling them what they need or I'm telling them what their condition is. We sort of co-diagnose. We own this condition together, and they really become partners in treatment. So I think that that's a really huge factor. Of course, our ability to look at and to analyze things in a much more accurate view, being able to magnify things literally hundreds of times what I conventionally saw it. I'm no longer straining. I remember looking at these little mirrors in the back of people's mouths, and they'd always have cracks in them from where you autoclaved them, and you're looking at the posterior part of the mouth, and I know that I could actually see this stuff, but now by how I look at things now, it's crazy. I just can't imagine I was really taking care of people, under those circumstances. And I think the patients absolutely can see the difference. The state of the art now, obviously, is interactive CT analysis. So our ability to look at things three-dimensionally and share that with patients and enhance the predictability is huge. Little half a millimeter variations in the way implants are placed, is a huge factor in not only the the risk versus benefits discussion, but it's also enhances the predictability and the longevity of the final prosthetic. So, I feel really good about our ability to create results that are probably better than what I would have expected was possible even a few years ago. You're going to see continued enhancement in CT analysis, and not just from the diagnostic phase, but I think you're going to start building, from that. I think access to that information is going to be not just limited to single offices, but you're going to see that coming across the internet so that you can share information between clinicians, referring doctors, the laboratory in a way that has never been done before. So instead of one clinician or sharing that 3D data with just his patient, with the patient's permission, obviously we're going to be able to share that with multiple physicians and really enhance the quality of care in a way that has never been done before. Let's see, what else do I end up thinking? It might be really interesting how if you really get out there, I think this next decade might be a decade of bioengineering. It's really going to be interesting how maybe 3D technology is going to affect bioengineering. Maybe we'll be in a position to not just develop stereolithography models of jaws, or faces, but what's the possibility that we can take that kind of CT data and reconstruct people's faces, real life faces. I mean, I think that the future is going to be incredible, and I think it's really exciting to be part of it right now. We have been doing interactive CT surgery for 12 years, and I have not had a CAT scan in my office. We're building out a new facility that's going to house a new cone beam, so I'm really excited about that. I'm getting a little bit greedy though. I see how cool that is and what the possibilities are. So as my plans has been just to have a regular cone beam, but we've got 2 digital Panorexes right now, one in the teaching center and one for our regular clinic. So one of the things that I've talked about, and I got to sell my wife on it, is the ability to end up having, not only like a major cone beam that can end up doing the full face and cranium, but maybe one of the smaller cone beams that has the ability to take a nice digital Panorex SF and just small sections of the mouth that we could end up doing, not necessarily for the initial scan, but for quick periodic scans or when we're just dealing with individual areas. Those are some of the things. Yeah, I mean, I've in the last couple of years, once I got started, I started accumulating more of these digital toys, and so I guess that's my next thing on my wish list, and that'll happen this year for sure. At least I'll get at least one CAT scan here. I think success is creating as much pleasure in the lives of people that I care about and in my family, and creating as little pain.